Welcome to our instruction video. I will show the steps for preparation, how to collect the samples correctly from the subject, and how to interpret the results. At the end of the video, we will look also at how to dispose the materials properly. Let's look at the components. First of all, we have the first test cassette. Secondly, we have the bigger tube with the liquid to collect the spit. This includes the collection funnel for easy collection. In addition, there is the pipette for introducing the sample into the cassette. For the remaining two sample options, you will find the sterile swab, also a test tube and a buffer liquid. Before we start the test, we make some preparation. All components are laid out on the table. It is important that you also take safety measures. Please wear a mask at least, because every test person could be infected. In addition, the complete test must be carried out at a room temperature, so at about 15 to 30 degrees Celsius. So let's start. Variant 1, spit test. All preparatory measures were taken and the test person washed her hands. Please do not forget. We are now starting to collect the withdrawal. To do this, we take the buffer liquid already inside. The funnel is to be turned into the tube. Now it is important to cough into the elbow about 3 to 5 times to collect potential virus molecules to the mouth area. Then spit through the funnel into the tube. There is already 1 ml of liquid in the tube. With the spit, you need to get a total of 2 ml of solution. The funnel is twisted off and disposed of immediately. Now shake the tube back and forth 10 times so the solution can be mixed well. We put the tube aside and open the packaging of the test cassette. It is very important that you place the test cassette on a straight surface so that the liquid can flow well through the paper. The solution is now drawn up with the help of the pipette. Now we put 3 pots into the S well, and after that, please take a mobile phone or a stopwatch and time it. The result is readable after 15 minutes. Very important, please do not read results after 20 minutes or even later. This can lead to falsification of results. Variant 2, tongue swab. Now the next 2 test opportunities. First, we prepare the saliva collection on the tongue, lollipop. The packaging of the swab is torn open, but the swab remains in the packaging so that it remains sterile. We prepare the tube and screw off the cap. Next, we take the buffer solution and turn the cap until it breaks off. This can be disposed of immediately. The buffer solution is poured into the tube. As before, cough 3 to 5 times in your elbow beforehand. Now we take the swab and place it on the tongue. Please wait 20 seconds and meanwhile turn the swab back and forth on your tongue. Then insert the swab into the tube and turn it 10 to 15 times to the left and right. Please dispose of this immediately afterwards. The tube is closed and set aside. We open the foil of the cassette. Now we put 3 drops from the tube into the S well of the test cassette. Again, wait for 15 minutes. Variant 3, nasal swab. The next collection variant is the nasal swab. Again, the packaging of the swab is torn open and set aside for the time being. The buffer liquid is poured into the test tube. Now we take the swab out of the packaging and put it in the nostrils. 2.5 centimeters is fully sufficient here. The swab is turned left and right in the nose 5 times. Then the same is done again in the other nostril. The swab is put back into the test tube and turned left and right 5 times. We close the lid and twist off the upper cap. Now 3 drops are poured onto the S opening of the cassette again. Again, we stop the time for 15 minutes. Reading the results. After a waiting time of 15 minutes, we can now read the results. The right interpretation is now important. You see a reading window And in this window, we see two areas. The C means control. A red line must always appear here after performing the test. Only then can you be sure that the test was performed correctly. The T meaning testing, if red, appears here. The test is positive. It is important that the line can also be somewhat weaker. However, this is not a problem, and the test can be scored if control line C does not appear. The test must be repeated again. Proper disposal. At the beginning, I already mentioned the proper treatment and also disposal of the individual components. Please do not leave the used components on open surfaces, but dispose of everything immediately into a rubbish bin. Always follow the instructions for use. If you get stuck in the process, you can simply look into it. In the IFU, it explained in detail, step by step, how to perform the test properly. Good luck and stay healthy.